So today we're going to talk about growing pain, or when you have that adductor strain in through the inside part of this leg. We're going to go through a step-by-step process to figuring out and how to solve this problem. We're also going to get into a little bit of like why our healthcare system misses the boat in treating something like this, and which is why it'll continually come back. So my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. We help put the pieces of the puzzle together. And today we're going to talk about that adductor strain and a step-by-step process to solve this. Where we go wrong in the medical community, for the most part, is I always say where the side of the pain is often not where the source of the problem is coming from. We've got to get into why. Why is this tightening up? And a lot of times this can tighten up for protection because there's something else that's going on. And in our medical system, we usually go like, let's just go directly to it. Let's just dry needle it. Let's do soft tissue. But it just keeps on coming back. And there could be a reason why. And that's what we're going to talk about next. So we have a step-by-step process. We say, you always have to check mobility first. And what do I mean by that? Mobility meaning how do the joints move? How the joints move in the back? How do the joints move in the hip? If we're missing something there and something's not moving correctly, then you're going to get that compensation, and that could be the reason why you're getting tightness in that area. The second piece that we will look at is soft tissue. So if we screen out the mobility, and we're going to show you what this all looks like here in a second. If we screen out the mobility, then I'll go into soft tissue to release some tightness, because maybe you're just overworking that area, and we've got to look at that piece next. So we can release the soft tissue so that it will be able to fire again. It's kind of how I describe soft tissue. Is like if you have a muscle that's tight, again, you have to get to why is it tight? Is it tight from protection? Is it tight from overuse? Is it tight from compensation? We've got to figure out those pieces. But if you think about it, if you think of a rubber band pull and a rubber band apart, that's what our muscles do. It contracts and relaxes. If you take that rubber band and you put knots in it and then you pull it apart, it makes so much, you pull and you'll get so much more pulling on the end, which is why you'll get it pretty high up. I don't ever focus up high up. It's usually the muscle piece of it that is the problem. So that would be the second thing that we'll look at is soft tissue. Third thing is strength. So this is where we have to look at what are the compensation patterns. Why are you overworking this area? Or, you've got to get into all those pieces to start working on getting the strength back and all the muscles around that area. And then the last one is just the function. So we're going to go through kind of the first three. I'm going to give you some exercises that really work on the first three things. We're going to go into a mobilization that works really, really well, as well as showing you kind of how you can hit the soft tissue once we figure out if the mobilization actually is where we need to go first. And then we're going to show you an exercise that we can do starting out to start working on some strengthening in that upper adductor area. So the first thing is we've got to check the mobility. So we're really looking to see how do the joints move in the hip. And there's several different ways. Usually with something like this, you'll move really easily this direction, the other side, and you'll just kind of compare it. You'll notice that like you can move this side and that'll move very similar to this side, and you won't notice any kind of issues there at all. You'll notice that if you take your hip, again, kind of just checking it and checking the range, when you take your hip like forward as far as it can go and you check the other side, you're going to notice that it's going to be very similar. So just check all those ranges. The range that usually is limited when someone has adductor issues that we always want to check is, we call it horizontal abduction. It's when the leg is up and you bring it to the outside. You're going to notice like one side will be like way up here, and then you do the same thing to the other side, and all of a sudden this one can go down a lot farther. So that's what you're kind of looking, is checking to see like, oh, are they pretty even? If they're not even, you definitely have a mobility issue. And then what happens is the muscle in that adductor area, the muscle on the inside here, will actually protect and tighten up. And so if you've had it long enough, it will shorten, and you definitely need to go into the next phase, which will be the soft tissue phase. But let's go on an exercise that we show our clients on how to improve that mobility. So let's say this side's not moving very well. It's closest to the camera. So you're going to get to the far end of the table, and what you're going to do is you're going to bring the leg up like this. So you want it to be, 90-90 essentially here. Then you're going to take your body and you're going to actually rotate the opposite direction like this. That way you can actually use your body to kind of force that hip down. So I can come here and I can almost like use my body to kind of force and put pressure through this area. You're going to feel it. If it's tight, you're definitely going to feel it. And you're just going to work on just holding that and breathing and trying to stretch that joint down. You can look at the other side just for comparison, just to kind of see, like, do I have similar range of motion on that side? And that's how you'll kind of know. So that's the first phase. And if you're doing that stretch, you're going to want to hang out there for a good minute, 2 minutes to really work on just stretching that joint in that direction. And if you get that mobility back, then that next phase is just checking the soft tissue. A lot of times, if it's been something that's very recent, the soft tissue in this area is just protecting because of the joint. But if you've had it for a while, what happens is because the protection's been there for so long, you'll get a lot of shortening. And where you'll get shortening is like right in through here. So you'll find the spots in the adductor right in through here that you can just kind of start finding. If you like, oh gosh, that's tight, I can feel that, then that's where you want to work it. And you just kind of work up and through here. This is the area that will get really, really, really tight through there. Don't be afraid, because you'll also find little like bruised finger spots, because this area has a really good blood supply to it. So you might notice that you'll get some bruising there. Don't freak out about that, but you just can kind of work in through here. So when we've checked the mobility, we've been doing the stretch, we're releasing the soft tissue, now we want to work on getting that strength back. And so what you're going to do is you're going to use a ball. This is really good. It's a really good one to start out with, because it's going to work high up into that adductor. And so I'm going to go in. I know we've been working on the right side, but this is actually for the left side. So the leg that's on top, you just want to feel grounded with your feet on the wall. You're not really going to kind of push in, just so that your feet can kind of feel the wall. Then what you're going to do is you're going to tuck. When I tuck, it's going to get you to use the inside of these legs a little bit more. Then you're going to push the knee down and you're going to pull back. And as you do that, you're going to feel it on the inside. Go back center, push down, and roll back as you push down. You can even roll back forward, but really it's going to be the rolling back. So again, tuck, knee gets pushed down, and you roll back, and you'll really feel it on that inside of that leg that's on the top. So those are some exercises. I would say doing those like 20 times slowly, and maybe a couple times a day. If you're noticing that your mobility has been an issue, you always want to start there. Start there first, hold it for a minute or two, again, 2 to 3 times a day, where you're really stretching it. Sometimes, like in bed in the morning, you can stretch it that direction, just kind of hang out there before you get out of bed. It's a great way of doing it. Works really, really well. But you've got to get the mobility back before you can start working on stability. And if you don't do that, that's a missing piece, and that's why people... we've had clients that have been to so many different people. Nothing has worked. They come in here and we're like, oh, this is what it is. And they start getting better. Typically they can't run. They're having issues with running is really one of their big complaints with it, or just like a dynamic, like moving forward. And so these are the beginning phases of what we give people for strengthening. But again, you got to go through mobility first, then you check the soft tissue, then you can go to strength, and then we get back to function. So those are the 4 phases. Again, if you like what we're doing, make sure you like the video. If you have any comments, just go into the comment section. We put other videos that are similar in the description if you're looking for more information. And make sure you subscribe. We're putting out content all the time.